Hello everyone. Today we are going to discuss about common cold. That is the most common disease which are we are encountered in day-to-day practice. So what is common cold? It is an acute viral infection of the upper respiratory tract in which the symptoms of rhinorrhea and nasal obstruction is prominent. That means running nose and nose block is the most common symptoms of common cold. Now, come to the etiology. So, what is the most common organism causing this common cold? That is rhinovirus. Rhinovirus is the most common organism which is causing common cold in pediatrics age group. After that, that is respiratory sensitive virus, and sometimes it is caused by influenza virus also. The time of prevalence in a year, that is most commonly in the season change time, that is August to October is the time in which the child is mainly suffering from rhinovirus common cold. And in respiratory sensitive virus it is December to April, and this is the time strain in which the child is mainly suffering from this type of common cold. Neonates is not mainly suffered from common cold, as because they are having some antibodies in their from their mother. But after the neonatal period, when the antibody gets resolved, then the child is mainly suffering from this type of viral common cold. And they are, when the age is increasing, this disease is decreasing in trend. So when the when the age is increasing, the disease is decreasing to some extent. So what is the pathology behind this common cold? First, this disease is contaminated by three routes. One is direct contact. Direct contact means the respiratory sensitive virus or rhinovirus is directly contact from the source to the normal human being. Small particle aerosol by coughing. And after that, the third mode of spread of the disease is large particle aerosol by sneezing or the attachment of the mucosa to the normal person. Mostly 95% patient having this direct contact from a patient to normal human being. So how this virus get involved this disease? When this virus enter into the nose, it enter into the nose and it put in the epithelial tissue. In the nasal epithelial, they are replicated, and they are replicate and they are increasing their numbers. After that, they attach to the epithelial cells, and these epithelial cells, under the epithelial cell there are some phagocyte, and this phagocyte engulf the viruses, and the viruses is enter into the phagocyte, and then there is a reaction which causing inflammation and produce some interleukins and cytokines which causing increasing the goblet cell to produce more amount of secretion and causing increased mucus in the cells. Now, the question is why there are repeated infection by these viruses? Because first, that is the virus having different types of serotype. When one serotype enter into the body produce some antibody. This antibody only kills that serotype only. But after some times, if body is again attacked by some another serotype, the body is then again have to do this same reaction process, and the antibody is produced against this specific type of serotype. So there are different types of serotypes enter into the body in different times and produces rhinorrhea or nasal symptoms or common cold. So that's why they are produced common cold throughout the year. And secondly, the replication time and the incubation time is shorter. So when this virus bacteria enter into the nasal mucosa, they replicate profusely in a shorter time. So that's why there is a huge amount of reaction occur, and the body, before producing antibody or reaction, doing some immunity reaction, they produce huge amount of viruses and which causing this type of symptoms. So now what are the main symptoms? So first, when the virus bacteria enter into the nasal mucosa, it causing irritation to the nasal mucosa, which is look like sore throat or scratchy throat. After that, there is a reaction by the phagocytes and the cytokine release of the cytokines, and this causing nasal obstruction and increase production of mucosa. So there is a nasal obstruction. After that, there is running nose, and after that, the systemic evaluation of the cytokines causing malaise or fever. And after that, there is cough. So cough starts after running nose. There are two types of cough. One is normal cough due to some vagal nerve stimulation, and second cough is viral induced airway disease. That means this virus bacteria and the mucosa enter to the trachea and also the bronchus, which causing there is a spasmodic cough, which causing there is a spasmodic cough, and this is cause virus induced reactive airway cough or spasmodic cough. So what is the diagnosis? How do you diagnose this common cold? This common cold is only diagnosed by clinically. So clinically, no investigation is need. You only clinical diagnosis the common cold. And there are some differential diagnosis of common cold. One is allergic rhinitis. Rhinitis. We have to differentiate common cold from allergic rhinitis. In case of allergic rhinitis, sneezing is the predominant feature, and there may be a history of itching of the nose or the skin. And in case of common cold, sneezing is not the predominant features. That is the nasal obstruction and running nose is the predominant features. Hansen's tint is the diagnostic of allergic rhinitis. This Hansen's tint is done in nasal. We take the nasal mucosal biopsy and we see the prominent IgE in Ansel staining. So this is the investigation of choice and one MCQ. Now, second differential diagnosis is foreign body. So if the foreign body is entered into one nose, this foreign body is stuck in the nose, which is causing foul smelling discharge, and also there is unilateral nasal block. Now, third differential diagnosis is vasomotor rhinitis. Vasomotor rhinitis is mainly due to vagal nerve stimulation. This is mainly triggered by taking some spicy food or some irritant or during winter weather changes. Suppose some human being is entered into some windy area that causing there is a running nose and due to some this vasomotor vagal nerve stimulation. So now the treatment part. This is the most difficult part, and this is in this part we are dealing with the treatment. So treatment is mainly the symptomatic. Symptomatic treatment is the only treatment of choice. So if the child having running nose, then only we have to give saline nasal drop or nasal irrigation for less than 6 years. If there is a nasal running nose is in more than 6 years, we can give oxymetazoline if there is a tremendous nose block and the child not taking air properly. So only oxymetazoline or xylometazoline is given when there is a severe nasal block. Only the child having some running nose, you only give saline nasal drop, irrespective of any age group. But less than 6 years, if the child having severe nasal block, we can give oxymetazoline in low dose only. Second is, if the child having fever, so we treat with paracetamol. If the child having some sore throat, we give them warm water gargling. Now there is only one drug of choice for the running nose, that is antihistaminic, is the drug of choice. First generation antihistaminic is the drug of choice. First generation antihistaminic is the drug of choice for running nose. So only first generation antihistaminic is the drug of choice. Why? Because the first generation antihistaminic have some anticholinergic property. This anticholinergic property is cholinergic property is only effective for running nose. No antihistaminic property is effective for running nose. So we only give first generation antihistaminic if the child having running nose in severe form. Now, if the child is suffering from cough, so we do not give any cough suppressant. It is very important. So we do not give any cough suppressant. We only give bronchodilator if the child having suffering from virus-induced reactive airway disease or spasmodic cough. So if the child having suffering from spasmodic cough, then we only give bronchodilator. So this is the only treatment of choice. So symptomatic treatment and nasal irrigation or saline nasal drop is the treatment of choice. We can give antihistaminic first generation if the child is suffering from severe form of running nose or nasal block. We do not give any cough suppressant or mucolite for this patient. Now come to allergic rhinitis. So allergic rhinitis is one type of rhinitis is due to some allergic reaction in the body. So it is defined as the child having type 1 hypersensitivity, inflammation of the nasal mucosa. Second is it is induced by exposure to the allergenic substances. And third is it having two out of the four symptoms. One is the symptoms are sneezing, rhinorrhea, nasal itching, and nose block, which is present more than 1 hour in a day or most of the day in a year. So, if the child having these three criteria fulfilled, then we call the child is suffering from allergic rhinitis. Sneezing is the predominant feature, and rhinorrhea after that. Why sneezing is predominant feature? Because this allergen, when entered into the nasal mucosa, it irritates the epithelial tissue, and beneath the epithelial tissue there is presence of increased amount of IgE and increased amount of eosinophil. This eosinophil is produce some inflammatory product after when the allergen is entered and stimulate the eosinophil. This irritant product stimulate the vagal nerve, and this vagal nerve stimulation causing sneezing. So sneezing is the predominant feature because of the stimulation of the eosinophil by the allergen. Now, what are the different types of allergic rhinitis? We divided allergic rhinitis into four types by the symptoms, based on the symptoms and the severity. Based on the symptoms, we divided the symptoms into intermittent symptoms and the persistent symptoms. Intermittent symptoms means the symptoms, that means running nose, rhinorrhea, nasal block, or nasal irritation is present less than 4 times in a week or less than 4 weeks in a month. And persistent means the symptoms present more than 4 days in a week or more than 4 weeks. And according to the severity, we have divided it into two parts. One is mild severity, one is moderate to severe severity. Mild severity means this running nose, sneezing, or a nose block does not hamper the day-to-day activity, sleep, or study, or does not cause any troublesome symptoms. So it is mild grade, but there is a running nose present throughout the day. If they produce one or more of the symptoms like running nose or disturbance in the day-to-day activity like sports or hamper the study, then we call it moderate to severe. So divided allergic rhinitis into four types. One is mild intermittent, one is mild persistent, one is moderate persistent, one is moderate intermittent. Come to the symptoms. As I said, the symptoms is mainly sneezing, rhinorrhea, nasal itching, and nose block after the exposure of the irritation. Now come to the diagnosis part. The diagnosis of allergic rhinitis is based on the detailed history, characteristic sign and symptoms, and it is mainly confirmed by the presence of allergen specific IgE. This allergen specific IgE is mainly done by in vivo test or skin peak testing. It is done only by this allergen specific IgE and Hansel's tint of the IgE by the nasal mucosa. In our day-to-day practice, we are seeing that for the allergic rhinitis, every physician is giving total IgE and eosinophil count for the patient. But this total eosinophil count and total IgE has lack of sensitivity and specificity. So routinely, please don't do this test because this is useless test. Now come to the treatment part. Treatment is first, that is avoid of the allergen. So please avoid the allergen. It is the first and foremost treatment. Next is symptomatic relief treatment. Second generation antihistaminics. So second generation antihistaminic is the drug of choice for allergic rhinitis. In case of common cold, it is first generation antihistaminic. In case of allergic rhinitis, it is second generation antihistaminic is the drug of choice. Inhaled corticosteroid is only used for the control medication and it is used after 2 years of age. So controller therapy is by inhaled nasal steroid. What is controller therapy? Controller therapy means if the child having persistence of the symptoms, then it either mild or moderate or severe. If the child is suffering from persistent allergic rhinitis, persistent symptoms of allergic rhinitis, then we only give inhaled nasal steroid for the controller therapy for 3 months and do not weaning off is stopped by after 3 months if the child having symptom free for 3 months. Now some higher treatment is if the child having suffering from persistent moderate mild or persistent moderate symptoms allergic rhinitis type of allergic rhinitis, then we give allergen specific immune therapy. AIT, allergen specific immune therapy, is given for moderate to severe persistent allergic rhinitis. The most preferable method of giving allergen specific immune therapy is sublingual immune therapy or subcutaneous immune therapy. So these all are MCQs. Allergen specific immune therapy is now introduced in allergic rhinitis in case of moderate to severe persistent allergic rhinitis cases. Now this is the algorithm. So if a patient having continuous running nose and sneezing, then first you have to diagnose that the child is suffering from allergic rhinitis. It is diagnosis is based on the symptoms and some investigations. Investigations mainly by the nasal smear eosinophil count more than 5, that is Hansel staining. Second is increase IgE 4 times from the normal to differentiate to diagnosis the atopy. And specific IgE for specific antigen is the investigation of choice. And symptoms are 2 out of the 4, that is rhinorrhea, sneezing, nose block, running nose. Now, when you diagnose the child is suffering from allergic rhinitis, we first educate the patient to avoid the triggers, and then we divided the patient into types of allergic rhinitis. So if the child having mild intermittent type of allergic rhinitis, then only second generation antihistaminic is the treatment of choice. If the child having mild persistent, that means there is no such problem of day-to-day activity, but there is presence of running nose and sneezing more than 4 days in a week, then we give second generation antihistaminic and also we give inhaled corticosteroid. So, in case of persistent, we give inhaled corticosteroid, and for mild cases, we give second generation cephalosporin. For the moderate to severe intermittent patient, we give inhaled nasal steroid plus we give nicotine receptor agonist and immunotherapy we can consider. But in case of moderate to severe persistent cases, the immunotherapy is more foremost important, and also nasal ligation we can do if the child is having severe nasal block. So inhaled nasal steroid and liquid antagonist is the drug of choice for moderate to severe intermittent allergic rhinitis. For the mild persistent, we give inhaled nasal steroid and second generation antihistaminic for SOS therapy for the symptomatic relief. This is the treatment protocol.